Dr. Salvaggio, did I say that correctly?
Yes, ma'am.
All right, Dr. Louis Salvaggio joining us from Cardiovascular Institute of the South. It's Valentine's Day, so why don't we talk about your heart? Because the longer you keep it healthy, the more time you can spend with your loved ones, correct?
That's right.
All right, now we talk about heart disease, and you guys do your best to educate the public. Now, what are some of the major risks of heart disease?
Well, the risks that we worry about are ultimately a heart attack, stroke, and complications of hypertension and high cholesterol.
All right, and what are some of the things that folks do that could increase the risk?
Around here, it's what we eat a lot of the times. That boudin and crackling, although it tastes good, isn't good for you. Smoking is a huge risk factor. Uncontrolled high blood pressure, high cholesterol, and diabetes. So those are sort of the things that we're looking at reducing or treating in order to reduce your risk factors for heart disease.
Now, in terms of having some sort of cardiac episode, some folks may not have any symptoms, so it's important that they see their doctor. What are some of the symptoms that people might recognize that they should know, okay, I need to call 911 or go see the doctor?
The classic symptoms are mid-sternal chest pain that radiates down your arm, sometimes associated with shortness of breath, nausea, sweating, or dizziness. But it is true that some people don't have symptoms, but if you dig deep enough, what you'll find is that they're just doing less than they used to. So fatigue, not exercising as much, not being able to do those activities around the house like sweeping, mopping, or picking up, it could be heart-related.
Now that brings us, of course, to prevention and also making sure that you maintain a good, healthy lifestyle. But one of the things that you need to do, of course, is to see a doctor regularly.
That is true. That is true. You have to think of your body just like you would your car. You know, you need to bring it in for regular maintenance. So it's important that you see your physician at least once a year. You get screened for your cholesterol, checked for diabetes. If you have high blood pressure, making sure your numbers are correct. If you have high cholesterol, making sure that your numbers are taken care of with medications, but nothing beats proper diet and exercise.
All right, thank you so much, Dr. Salvaggio. They don't want to see you in a bad situation. They just want to see you to make sure you're doing okay.
That's correct.
Thank you so much. We're going to take a break right now. Happy Valentine's Day. Don't go anywhere.